My name is Christi Venable, and I am the CEO and founder of Smile Therapy Services. And we are a mental health and wellness agency. We're based right here in the DC area, providing services all over the United States. Our goal is really to go in and help corporations, organizations, and school districts put in place preventative mental health support for their workplace. And so we also are on a mission to just uplift the mental health just topics and, talk through different things that we are going through, have those talks that are needed that no one is really discussing. And so I am so glad to be here today with two phenomenal women in healthcare. And so for me, it's just super exciting because I love to also just get to know about other women in different fields and really talk through what they are going through. And so I am going to let them introduce themselves, and then we are going to get into the conversation. And so we will get started with Dr. Presson. If you can introduce yourself to the community.
Okay, well, I'm Dr. Takeisha Presson, owner and founder of Dimples Dental Suite and founder for Dimples Dental Suite Foundation. I am a practicing cosmetic dentist in Washington, D.C. I've been doing this for about 16 years. One of the things I always tell people I'm proud of, I'm a true Washingtonian. I'm a D.C. girl through and through. So do not let the degrees and dollar signs fool you. We can get savvy with the best of them. That's me.
And that is my type of girl, because everyone knows that I am DC through and through as well. And so I am just loving it. I love when I meet my DC people, and I even love it more when we are just doing what God has called us to do. And so thank you so much. And next we are going to go to the best registered nurse in this side of town, Miss Meedie. Please introduce yourself.
Hey, Chrissy, thank you so much for having me. And hello to my sister, Dr. Preston. I appreciate this opportunity to share. My name is Meedie Bardonille, and I am a registered nurse. My first and most important role, however, is being Anthony's mom. So shout out to my 16-year-old out there and Tony's wife. I am the founder and president of the Black Nurse Collaborative, which seeks to continue to elevate health and excellence within nursing in particular. And also we use our collective influence to have a positive impact in our community. So I'm excited to be here, and I can't wait for us to have this amazing discussion. I'm not from DC, even though I've been here since 1993. So I've been here more than half my life. So DC is truly home, but I do hail from the Commonwealth of Pennsylvania. So I'm excited to be here, and also a proud Howard University grad.
Okay. HU.
Okay, well, I know we're going to have some HU people in the comments because, one, I have a lot of staff that is proud graduates of HU, and we have a lot of HU fans. So definitely represent. And, you are an honorary DC person at this point because you have been here for a long time. So definitely welcome to the DC family. We are going to get it started. And so we're going to go straight into the questions. And I just love that we're all from different areas of the healthcare. And so this first question is, how has the pandemic impacted the healthcare system within your respective fields? And so really the pandemic hit us all at a magnitude that we really weren't ready for, I feel like. But it really hit us all differently because we were in different types of fields, and even though we all were in the healthcare. And so I'm really interested to see, how did, from your lens, how did it impact your field? And anyone can get started.
Sure. Well, I'll take that one, being the self-proclaimed super nurse. So listen, Chrissy, that conversation, that question you asked, I'm sure Dr. Preston and I can be on here for a whole hour just with that one conversation. So the first thing is, it completely up leveled what we know as traditional healthcare. More importantly, as healthcare providers, it impacted us, not from just me as a nurse, but I'm sure Dr. Presson, even her more so, because she's in people's faces, literally, as being a practicing dentist. And so what we realized is that health is the greatest wealth asset that we have. Health is important. It highlighted and illuminated the number of health inequities and disparities that we already knew about, but COVID definitely pushed those to the forefront. It also further shined a light, if you will, on the importance of health. It shined a light and the importance of those like myself and Dr. Preston, who are health practitioners, because quite frankly, we are putting ourselves in harm's way every single day before COVID. So people forget that there's still MRSA. People forget there's still C. diff. People forget there's still tuberculosis. People still forget there's HIV/AIDS. People still forget that there's these other communicable diseases that we deal with on a day-to-day basis. So for me as a nurse in particular, it was very daunting. It was scary. We also, just like the general public, were kind of taken aback by this COVID thing, what it is, what does it mean, how do we treat it, how do we continue to provide healthcare in a safe manner, but make sure we too are still safe, because it was such a highly communicable, and still is, highly communicable disease. And so I think for me, it made us reimagine what healthcare is. It made us reimagine how are we as healthcare professionals also, and I'm sure Dr. Preston would agree, how we are taking care of ourselves. It helped us to reimagine how do we truly address health inequities and disparities, because what was most important for me, Christi, was it made us realize how there are so many people who are already underserved, underinsured, and undervalued. Now you add onto this national, international pandemic, and how do we still continue to get treatment to them? So for me personally, no shade, Dr. Presson, don't come for me, but I do feel that nurses were literally the ones particularly there every single day at the bedside. And I do know that my fellow compadres like Dr. Presson, they had to, and I'm sure she will speak to this, they had to reimagine how are they going to provide care as well. That was the first time I went back to my dentist. She had on this huge face shield. I had to put this extra thing in my mask, my mouth, Dr. Presson, to get my mouth clean. And I felt like I was going to gag the whole time, because we had to use innovation. And so for me, I think it was just really, Christi, everything you thought that you knew, you didn't know. That literally was it. Everything you thought that you knew, that you thought you were well equipped with, we go through many opportunities to learn how to manage scenarios. COVID literally turned everything upside down in this pandemic. And we were scared doing it.
And you were scared. And I want to just highlight that notion of us knowing the disparities, but it being, magnitude by the 100th power during COVID. And I'm sure for all of us, that was hard to see, us being in the healthcare field and being of color, that was hard, for a lot of us to manage. But like you said, and then had to jump in and help, where we could. And so definitely appreciate all of the nurses and doctors being on, all of us in healthcare being on the front lines, because we were all in crisis mode. So thank you for sharing that. And Dr. Presson, how was it for you?
For me, it was a little different. And I'm glad you specified for me. For me personally, I'm a daredevil. So when the pandemic presented itself, for me, there was no fear. It was a matter of what can I do to help? I'm the one that if I see an incident on the side of the road, I will pull over. I have had burning cars. I have seen people in trees and I'm helping them get out of trees. Like, I'm never the one to shy away from an emergency or a situation, right? So my take from the very beginning, when it was mandated that all dental offices should close and only perform services that were considered emergency, and the ADA, which is the American Dental Association, presented a list of what would be perceived as emergency procedures. My thing was, I wasn't scared. I'm a little bit different. Like I said, I'm a daredevil, but I don't have kids. I don't have a husband. I didn't have anyone to bun up to. So if there was anyone else to serve, why not me? That's how I looked at it, And it wasn't that I had a death wish or anything like that. I was just like, literally, I am the perfect candidate to serve. I have provisions put in place that if anything does happen, I'll go out on good terms. But either way, I knew that someone needed to step up. So when a lot of my colleagues were residing in fear, because she's absolutely right, nurses were on the forefront of this pandemic with the doctors in the ER, but my job was to make sure that the ER was not bombarded with dental emergencies. And like I was explaining earlier, what happened with a lot of people, there were lots of dental issues that were unaddressed that all of a sudden during a pandemic becomes a need to be addressed. That tooth did not just start hurting. That tooth did not, your mouth did not just start having these issues. However, when you're sitting at home and you have nothing to do, all of a sudden it starts to dawn on you, wait, my mouth is killing me, and so people started having issues that just, they were not new. They needed to be addressed. But how did it affect my pandemic? How did the pandemic affect my industry as a whole? Here's the thing. Dentists have always been on the forefront of infection control. I always tell people, so we were already ready. And then I didn't even realize how much my office was pandemic ready until I was put in, in the situation. We were already using a lot of the products that they had to stop sending to us and send it to the hospitals. Like we were already using certain products. And when she talks about the device that her doctor used on her, more than likely it was a suction device that would allow for prevention of an aerosol mist, right? Well, guess what? I've been using that in my office for years. So it's one of those that's used on every patient. We've always pretty much had the HEPA filters, and we didn't realize like we were already ready. A majority of us we were already ready. So dentists as a whole, because we were on the forefront of infection control, we were ready, willing, and able to serve. It was just there were mandates put in place that said you cannot do anything. And as I said before earlier, the World Health Organization scared people. When they sent out that message telling people to avoid the dental office at all costs, people thought, do not go. This is the place you're going to contract COVID. This is the place where you can end up in a hospital. And to, the nurse's point, my sister's point, the bottom line is I see someone's trying to get in. But to my colleague's point, people started to realize that there wasn't an issue with going to the dental office. We had to get past people's fear. We were ready, willing, and able to serve. We already had the precautions put in place. It was just a matter of people getting over the fear that was put in them by outside factors that were beyond our control, such as the World Health Organization. And again, the American Dental Association and a bunch of the other dental organizations around the world jumped in and said, no, you can't do that. Dentists have already been doing various things and we're ready, and we need to be on the front lines to make sure that the hospital is taking care. The hospitals and the nursing homes are taking care of the people where they need to take care of them, so that resources are not being exhausted and misused.
Yes, thank you. First of all, so much, right, for that perspective. And as I was telling you before we came on, I felt like the dental office actually was one of the safest places, honestly.
Mm-hmm.
My orthodontist was still open, my dentist was open, and you're right, they did have a lot of those different things already in place pre-pandemic. And so, they were really ready when the pandemic hit, which was really amazing. And then on the topic of people sitting now and now fully realizing that that thing that has always been there is now, now I can feel it. It's heightened because I'm not moving. It's not the hustle and bustle because we all were mandated to sit.
Mm-hmm.
I feel like that also resonated in the mental health world as well, right? We already knew that so many people were dealing with, different struggles, anxiety, depression, but it was heightened to the 10th power during the pandemic. And so, just to kind of speak to the behavioral health or the mental health, we were in, definitely kind of crisis mode because one, we had to go virtual.
Mm-hmm.
And many organizations that focus on mental health, they actually didn't have a virtual component at all, right? We were lucky at Smile because we already were doing telehealth. This was already a part of, our practice. And so for us, it was nothing but, okay, we already know what to use. Now we have to get our clients, all of our clients familiar. And because we dealt with a lot of kids, that was really the part, that was the most difficult, trying to manage our kids during those school hours because I had school-based therapists. And so, I definitely feel you both on both ends. The pandemic, I just feel like turned each world kind of on its side, but in a different way. Right.
And Christi, if I can just add to what my sister had alluded to earlier, particularly about that fear component is, for me as a nursing leader, I never forget the day when our first patient got admitted to my unit and all of my nurses were looking at me. And so, and to your point, Dr. Presson, I am married and I do have a kid. And so my greatest fear really was because we were still trying to figure out what COVID really was, and we were still trying to figure out the best practices. It was like changing a tire on a moving car. And so for me, the fear was just the unknowing and making sure that I was going to still be the healthiest version of me so I can therefore lead my team and also come home and literally strip, not completely naked, but strip at the door to make sure before I hugged, kissed, or any of, or gave anything to my husband or my son, we put a basket out the door. I literally took my shoes off. I Lysoled my shoes outside of my house before I came in. I took my socks off. I went upstairs. I showered, brushed my teeth. You'd be happy. I think I brushed my teeth more during COVID. But I was like, brush my teeth, wash my face, everything, like completely disinfecting myself before, because my fear was, please God, don't let me be the person getting it because I'm in this environment every day. Because at first we had one patient, then we had two patients, then I had three patients, and then I had five patients. And then, Christi, I started seeing the very first time people dying in the ICUs because of being in an acute care setting. So for me, I will admit, I did have the fear and the anxiety and the trepidation of, and I wasn't fearful to provide the care. It was, what if it happens and I bring this home? Because at that point, then I had relatives that started to pass away. Yeah. I had colleagues in our hospital, one of our nurses in our hospital who died. So this is really early on in COVID. And so I think and you hit the point, Christi, you were just last alluding to, was the mental health piece of what if it was me? And I agree with you. Why not me? Yes, I am called. This is my duty. This is my passion, to serve and to care for people that are in medical need and attention. And I'm grateful that I am an unapologetic person of faith. So I will say it. I hope you won't kick me out, Christi. But I was like, God, protect me and keep me healthy and well enough so I can continue to do what I believe you've called me to do and to serve. However, the carnal part of me was, but God, please don't let me bring this home to my husband and my son. Please, please, please. Because this is all before we had vaccines. And so every day for 15 weeks, I'm going into the hospital every single day, Saturday, Sunday, even when I was quote unquote off. I wanted my team to know I'm here with you. And we're going to get through this together. So that mental health component, I think, was definitely highlighted as well.
Yeah. And I think, yes, Dr. Presson.
What my sister just said hits home, though, because what I did as an employer, I actually met with my team and I said, just because I'm willing to do certain things, I did not expect them to do the same thing. And so we had very real conversations about what their fears, what their anxieties were. And I gave them the option as an employer. What do you want to do? You can disappear for the next 3 months.
Yeah.
I'll sign whatever paperwork you need me to sign. I will support you. But this is what I'm going to do. And that, to me, I think was probably a missing link during this whole pandemic. I still believe in autonomy. You should still be able to do whatever you want to do for you. And because I'm willing to do this, doesn't mean that I'm going to impose that on my staff, because they did have family members that lived with them. They had kids. I didn't have those things. I had my dog Ash, so it was one of those things where I didn't have anything to risk it for. So yeah, I just felt like during the pandemic, people should have been more respectful of autonomy because the fear was real.
Yeah. Yeah, I definitely agree. The comments are definitely lighting up. Thank you for everyone who is joining us. I'm just going to highlight a comment um, from Miss Valerie, and she said, "My concern is because there is no more fear and therefore less precaution in general." But that's a great point about the dental practices already being equipped. And so now it's kind of like we've went through these couple years, and it's like, whoa, okay, it's gone, but we know it's not gone. And so she makes a good point that now, as we're trying to get to normal, we are being a little more loose, and not being as precautious as we were. But making sure I think as a whole, we should make sure that we still stay cautious because COVID is still out there. Yes.
And Christi, I think, I'm always what can we learn from this scenario? What was the silver lining? So here's what I would say. We kind of experienced this triple pandemic, right? We had this pandemic of the actual health issue itself. Then we had the issue of what I consider social justice issues with the murder of George Floyd. Then we also had the issue of what I consider the pandemic issue for me, this is me speaking, was also the social components of appreciating nurses, appreciating now how do we manage our kids? So you have hundreds and thousands of kids, millions of children that now aren't going to school. And so now parenting, trying to figure out what does that look like? Then we don't even talk about, and I know obviously with Smile Therapy, is what about the people who already were in domestic violence issues? What happened to those men and women? I mean, the women and men and children that were in scenarios where really that outlet of going to school or going to work was the only outlet he or she had, right? So now what happened? And so then you think about during this time of the pandemic, the blessing is the importance of your health. And to Dr. Presson's point, I had many of my friends say, Meedie, well, should I still go to the doctor? Absolutely. I've had 4 friends, literally not just people, but people within my inner circle that developed and had breast cancer within this 3 years of COVID. So if those individuals did not still go to their doctor, if they still did not go get those mammograms done, who knew if they would still be here today? As a cardiac ICU nurse, and you know this clearly, Dr. Presson, is that the most important exam you get before having open heart surgery is go to your dentist and you have to get dental clearing. Many people don't realize that. Your mouth is such a huge source of infection, and it controls many bacteria, that before you have major surgeries, you got to go see Demple's Dental Suite and get a clearance to say, yes, your oral hygiene is up to par before you can go have a knee surgery, or you can have open heart surgery, or that brain surgery that you need. And so people don't realize the importance of how interconnected health and wellness is. So what I found as the blessing, if you will, within this, and I don't want to say COVID itself was a blessing, but within the pandemic, is we had a moment to all sit. We had a moment to then realize the importance of your health and your well-being, because at the end of the day, regardless of what you do, people knew the world was still going around with or without you. Regardless of your political position, regardless of your financial position, your stature, whatever title, whatever job you had, your health and your well-being is the most important asset. And I always use this example, and God rest his soul, but Steve Jobs, who doesn't have an Apple phone or some type of product, right? For all you Android people out there. However, what I will say is what we realized is that even when he passed away, and God bless him, he was a multi-billionaire. He still did not have enough money to cure him of that pancreatic issue, that pancreatic cancer that he unfortunately succumbed to. And so it doesn't matter how much money or wealth you have, take care of you, because the world will find a way to do that next thing. And what I do know is even you, Christi, you're owning an amazing organization. You too, Dr. Presson, me, Black Nurse Collaborative. If I or any one of us today passed out and couldn't do it, somebody's going to pick up the mantle. And so take care of yourself. Go find that mental health person that's going to help you deal with whatever thoughts that you might have had. Reach out, and we learned how important community was. How is that little old lady across the street that you never really talked to, but now you know she can't go to the grocery store by herself because of COVID? I mean, there's so many other things. I just choose to live my life with the glass half full instead of half empty. And I do find that in this issue of COVID and this pandemic and health and well-being, that it forced the issue and the importance of mental health practitioners, because we still need many more of you all. It forced the issue of a Black and brown, specifically, and I will say this, of Black and brown healthcare professionals, because it was a disproportionate number of our black and brown brothers and sisters who were fearful, and that is the word, and did not want to go and get this vaccine, and did not want to go see Dr. Preston, or did not want to go to the doctor, because now they can't trust whatever it is. So in my last statement that I will say is, I also realized during the pandemic that the messenger is sometimes more important than the message. And so the messenger that we had at the time, and we all know who I'm speaking of, did not really give a very clear, succinct plan, was creating a divisive opportunity. So you already have these other issues in your mind. How do you decipher what's real or not? So I just think that the pandemic was an opportunity to realize, focus on you, focus on your family, your life, and your well-being.
That part.
Love that. I'm just going to highlight a comment. Said this conversation, bridging the connection between mental, dental, and physical health is profound and so necessary. Thank you so much. Yes, we are. I mean, such a great conversation. We're going to get to our next question, which definitely pairs right into the health part, right? And it's, what are you noticing as it relates to women in the healthcare fields and then burnout? And so, Meedie, you just literally was just talking about taking care of yourself. And so, you know, from both of your lenses, what are you noticing as it relates to burnout in women in our fields?
Well, there's definitely an increase in women that are now being more vocal. I think women in the past were trained to not speak up on these matters because we didn't want to be stereotyped. You know, we felt like we had to take on the burden of always being present, always having to do our job, show up, hence be present, right? But now with the pandemic, I love that Meedie said this because I've been saying this for a while, which is, it's important to know your boundaries. And with the pandemic, I figured out what was important to me. Even though I had the attitude of why not me, understand me when I tell you, when I got set down because I started to have uterine issues, you start to think about what is important to you. And to your point, I jokingly tell my patients this, but I'm so serious. I said, I love what I do and I love up on my patients and I love them hard. However, I know that I'm replaceable. There's a dentist on every corner like a liquor store. Go find one. It used to be churches on every corner, but that's not the case anymore. There's a dentist on every corner. And so I am replaceable. And knowing that you are replaceable, I think the reality hit a lot of the women in the healthcare field, and in particular in dentistry, where we're being open and honest about, I need a break. I can't do this. I cannot do this. And how that translates, whether you need 5 minutes to yourself, whether you need to take a 3-day weekend, you know, go somewhere else or some type of retreat, go to an island. But I think that the difference now compared to pre-pandemic, we're being more vocal. We're being more vocal, and not only by us being vocal, we're actually seeking the help that we need. And again, it doesn't necessarily have to be whether it's through a smile therapy services or it's through the church, you know, or through your synagogue, or, you know, wherever you choose to fellowship, or whether I'm calling up my sister friend because I feel like I just need somebody I can talk to. Yeah. You know, people now are releasing, you know, as again, opposed to before, we were just holding it all in. So there is an increase in burnout, and there are various ways that people are going to get through the burnout that we can talk about in more detail. But at the end of the day, people are just being more honest. And I think that's on the forefront.
Yeah, love that.
And I'd add, Christi, and everybody clutch your pearls, because what I'm about to say, I know is very controversial. I don't necessarily prescribe to burnout. What is more fearful to me is compassion fatigue. So as a person, as a runner, a person who enjoys working out, and that's where I find my release is, you know, the trainer says it's good to get that burn, right? It's good to feel when that lactic acid gets there, but then you need to just simply rest. And once you therefore go and rest, to your point, Dr. Preston, whether it's the hour conversation, the cocktail hour with your friends, you know, speaking with your minister, whomever, however you choose to worship, or whether it's calling Christi and having your every Monday at 2:00 session so she can help you. That is where, for me, you can alleviate and not have burnout. I personally believe that this is me, y'all, so don't come for me. But what I'm saying is that burnout sometimes burnout is self-prescribed. But I found in healthcare, Christi, that there were so many nurses that were unfortunately chasing the dollar. And so they were taking these $10,000 a week sessions up in New York. I mean, I got multiple emails at the beginning of COVID, make $7,000, $8,000, $10,000, and just for, picking up 4 shifts a week because it was such a need. If you continue to do that, you will burn out if you don't rest. What was most concerning is compassion fatigue, which I think is when you get to a point where you just don't care. When Dr. Presson gets to the point, and she said it very eloquently, she loves hard. So what happens when she stops loving hard, when she stops caring about the patient that she needs to provide the best care for? What happens when she's like, well, whatever, I told them they need to take the antibiotic, but they chose not to. But then he or she's going to go ahead and get that surgery anyway. And then that person has a very negative outcome because she stopped and did not have, no longer did she care. And I think compassion fatigue is what was most alarming, because I even heard some of my colleagues, leaders as well, that mentioned that particularly in the ICUs at that time, they were just tired of people coming in and doing this every single day. So mentally, they've checked out. They were doing the check boxes, they were providing the care, they were given the medicine, but they were no longer caring. And for me in nursing, that is a differentiator between me and my other colleagues, is that we are, by virtue of our name, nurses are nurturers. We're the ones that are there at the bedside, whether it be 8 hours or 12 hours a day. So when that doctor or other healthcare professional writes their recommendations, we're the ones to fulfill that, and we're the ones holding your hand during that process. Yeah. And what was most frightful was people stopped caring and just came to work. So for those of you that are watching, I am not saying that there's not nursing burnout. Yeah. What I'm saying that what was more concerning is when we stopped caring. Mm-hmm. And so compassion fatigue and burnout are two different things. And I do believe that there is a remedy, as you alluded to, Dr. Presson, to burnout by resting. Stop picking up those extra shifts. Nobody said you had to work 10 shifts that week. Nobody told you that. You know what I mean? Stop, you don't have to pick up all the overtime. Say no. It's okay. Take care of you.
That's easy when you work for someone else. Because when you are an employer or an entrepreneur, no offense to anyone, but you have to think about how your bill is going to be paid. Because one of the things that most people don't even choose to recognize is that during the pandemic, a lot of dentists did not get help. I don't know if you are aware, but we were not on the tier for consideration, even though you forced us to close down. So even though we may have gotten some assistance from PPL grants, it wasn't until HRSA did like the second and third tier that they said, oh yeah, let's go take care of the dentists. And even then, they didn't give us a lot of money. So what happened, you forced people to close their businesses. And if they were able to see some patients, because of the inflation rate with, the cost of materials, because remember I told you, they took all of our materials and shifted them towards you guys. So we were already doing masks. We were already doing the infection control stuff, but everything was being rerouted towards the hospitals and the nursing homes. They forgot about us. So as it relates to our industry, no offense, but there was no extra money that was coming in. And God forbid you're in a situation like mine when you decide you want to open up a business on Capitol Hill and the District of Columbia says, because you're not in a blue zone or an economic need zone, we're not giving you anything. The District of Columbia did not give me support, financial support. Yet I went to the forefront and made sure that Washingtonians were taken care of. So I think it depends on your industry. And I also think it depends on your position, because I always tell people, you got to check every 2 weeks during the pandemic. You can't say anything to me. But if your income stopped during the pandemic, then we can have a conversation, because that's how you got in the position of burning out, because we're constantly working. Because even in the District of Columbia, I know that this is being filmed all over, it's live all over. We don't know where people are checking in from. But even in these United States, when they decided they were shutting everything down in the District of Columbia, they did a mandate where they said, you cannot be evicted. You cannot have late fees put on, but they never said you're not responsible for your debt. So,
wait, say that again. Say that again.
That's deep.
so when you know that, okay, your business has been stopped, and yet you have employees and you have supplies and you have this, and oh, by the way, you have a bank that doesn't understand that you can't pay your loans because by default, the system says that you don't qualify for the needed help. Yeah, you are going to burn out, and you don't know that you're pushing and pushing and pushing until times it's too late, until you get to that point. And I love that you said this. This is my first time ever hearing anyone say this, and I'm going to use this: compassion fatigue. You do not know that you have gotten to that point where you're like you said, I know I told you 2 weeks ago that, or I told you last year, I told you 3 years ago. Why are you coming to my office now? And then you realize that's not me.
Exactly.
That's not me. And the key thing is the ability to be able to recognize that. So I think it's easy, to say that, like you said, you're not saying that there is no such thing as burnout. But I just think that when it comes to certain industries and where your position is within that industry, it made it so much easier for us to get burnt out and to feel overwhelmed. And where do I turn, and how do I get through to the next day? But at the same time, I know God gave me this gift to be present for other people, and that's what I'm still trying to do. But I know that my well is running dry.
And I think too, Dr. Presson, that's why people like you and I need to ensure that we have a seat at the table. That's why, I'm looking in the comments that people didn't even recognize or realize that. Even I didn't know that as a nurse, that you all were not on that list to get that additional aid. And so it's interesting. So there's always a why. And why. And, a mentor of mine said, keep asking 5 whys until you really get down to the crux of the answer. Because like I said earlier, for dentists to be shut down, and now I'm my heart is hurting for you all. I went to my dentist. Unfortunately, she was still maneuvering, but I do think it was important that people recognize the importance of what us as women in healthcare continue to lead, and how we continue to make sure that these issues are heard, because the general public doesn't always know that.
Yeah. Yeah. I mean, hit on every point. You guys hit on so many points. And I'm in agreement, right? I stand in agreement with you all. The point about one taking the extra shifts, yes, but then if you are a business owner, you have no choice, right? And so clearly I was in that lane. And also having work as you know it get turned upside down, right? We had a whole school program that flourished off of us being inside of schools. Well, schools were closed. They had to go virtual. So now we were in the boat of competing with, you got virtual learning school, right? And then you had to try to fit yourself in some way, somehow. And so people fully understanding the impact of you as a business owner now trying to navigate this system. Completely agree, Dr. Presson. Behavioral health therapists were not under HRSA even until like the third one, like stage 3 or something. And then they added us to that fund of money. I'm grateful that they did.
They gave us pennies.
Yeah. I'm grateful that they did, but we also didn't get added because they only, I think, had it for like medical organizations. So it was just a lot to really take in, to navigate, and you had to navigate all of that. And if you were a business owner, still managed to make payroll, right? Whether or not you were getting the funds that you used to get. And so I will say to all of the business owners who may be on here listening, my heart was with all of us because it was a situation that many of us have never had to navigate. And for me, unfortunately, we saw a lot of people that didn't come to the other side. They weren't able to make it to the other side. And for us to be able to make it to the other side, they're definitely grateful that we were, right? And not that we were unscathed, but we made it to the other side. And so all of that plays into our well-being. And I agree that can get us to compassion fatigue, which is even worse than burnout, right?
Mhm.
Because
You have to remember how those social determinants of health continue to impact
yes,
everybody where you live, work, play,
yeah,
and pray. And so if we don't have people like you, Christi, I will tell anybody, public shout out, this is being recorded. I talk to somebody every single week
yep,
for an hour every week just to make sure. And that really only came after COVID and some other issues, but just making sure that I'm okay. And so
yes,
I just want people to realize, and I'm a PK, I'm a preacher's kid, I'm a deaconess at my church. I believe in talking to your spiritual leaders.
Mhm.
Do that, but also make sure they're individuals like Christi and others who literally have the psychological training to help you filter through those thoughts.
yeah,
I have two friends who also in the last several years, last 3 or 4 years now, have lost their child to suicide. And so I think it's important to talk about what does that mean. And so when we speak about as our topic today, women and healthcare, the wellness, healthcare, and self-care, being well and having health are two different things.
yeah,
I'm healthy because my Dr. Pearson said my teeth are good, my
Mhm.
eyesight is fine, my blood pressure is okay or whatever, but it doesn't necessarily mean that I'm well. If I'm stressed out and I have high level cortisols, if I'm not exercising every day, if I'm not prioritizing and eating a good nutritional diet. So by the textbook, I'm healthy. But right now, no, Meedie Bardonille, founder of the Black Nurse Collaborative, is not at my optimal level of wellness of
Mhm.
where I am. And I have to reshift and renegotiate the things that are on my plate to
yeah,
make sure that I'm a priority so I can show up and be the best for not just me, yes, for me, but also for, if nothing else, my husband and my son. And then everybody else, like Christi and Takeisha, can get the best of me when I'm
Mhm.
taking care of me.
yeah, yeah. Love that. Love that. We're going to go to our next question. So, as a woman in healthcare, how do you manage this whole idea? Because I think it is an idea of work-life balance, right? And so, whether or not I feel like if you have kids, you still have a work-life balance. I don't have
Mhm.
kids either. However, I just feel like I got a lot of nieces and nephews. I'm in a relationship, but it's like, how do you find that balance of, especially when you have such either you're a business owner or you are in a field such as that medical field. I mean, we are just prominent by nature. And so how do we find that time to really make sure that, yes, this is our industry, this is our work, but then also find the time for regular life?
Interestingly enough, last year or recently, an article came out stating that 1 in 5 dentists considered suicide, right?
Mm,
Last year, 1 in 5 dentists considered suicide. That's my reality. I always tell my patients, and I have some that I just talk to and they know how I am, but I said, I don't care who your provider is, ask them how they're doing. I'm a human being just like you. I'm not there just to provide a service. I'm a human being. I have ups and downs, I have highs and lows, and sometimes I can't always show up for you.
mm,
So maybe today I'm just focused on doing my job. And you better believe I'm going to do my job because you don't know what it is that I'm protecting and I'm holding and I'm shielding. I'll never forget the day that, like last summer, when my aunt died. I came into the office. No one knew anything until something happened and I snapped. I snapped. I snapped. And if you know me, I'm always going to be on an even kill in this office. I always tell people there's Dr. Presson and there's Takeisha. Well, that day they encountered Takeisha. Okay. You don't ever want to get to know Takeisha because that's the DC girl. I snapped. I had a moment of being unprofessional, but then I said to myself, you've been here several times before. Didn't you notice that something was wrong with me? Didn't you notice that I wasn't smiling as much? I wasn't laughing as hard. And I just came into the room and I was like, hey, this is what we're going to do today, blah, blah, blah. So I always tell people take that extra 30 seconds to figure out, even if you don't, it's just small conversation. Hey, how was your day, Doc? Because it sets the tone. Because even if with those 30 seconds, you make them feel like you care, right? But when it comes to the self care element, what I realized more than anything, I have to take time for me. I have to. And so through realizing that, yes, I'm going to be present for my patients. Yes, I need to do this and I need to do that. there are moments when I'm going to have to selfishly say, no, not doing this. Reschedule these patients. No, 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 because I don't want to be that statistic. I don't want to be the one that's so deep and dark and drawn to depression that I then go to the other side. People have no clue the level of stress that health practitioners deal with. And it's not just dentists, but that number stuck with me, that there aren't that many dentists in the United States to begin with. And to have 1 in 5 feel like they need to take their life in this day and age of social media, where everybody is focusing on just the instant gratification or the illusion of happiness. Everyone is not happy. You have no clue what most people are going through to get to the next day. So when she talked about the compassion fatigue, the first thing I kept thinking about was, where's the humanity? Because I felt like during a pandemic, we got a revelation of who are the people that actually adopt the attitude of humanity. We got to see that. So I tell people, go back to that whole basics of humanity. Treat people the way you want to be treated. And if you want people to be nasty to you, well, you gave what you got. But
Dr. Paulson, there's that book
I'm sorry.
There's a book that they said everything we learned how to do it in the sandbox. Please and thank you go a very, very long way. And I know for me, Christi, the question that you pose, I don't want to say the word it's simple because it's hard. And I was just asked this question about a week or so ago. I struggle with finding balance. And I think the first acknowledge that it's an everyday juggling act, because you don't always you can have a plan, but you don't always have control over external factors that impact your life. So for me, my priority first is me. And then my priority is my family. And then everybody else comes behind that. And if I'm not, I just, a week ago lost my father-in-law. And so same thing where I'm now my mental space, my mental capacity is now shifting because I have to make sure home is okay, even though I'm managing and doing all these other things. The other thing that I would offer, at least for me that has worked, is I schedule. If I know, like I'm in Seattle, Washington, Christi asked, and I'm traveling, I'm downstairs. I left the meeting because I said I planned and I had this on my schedule to do this thing. And this is a priority. So I'm going to go and do that. And then when I'm done, I'll be gone for an hour or so, and then I'll be back. And I think to your point, Dr. Presson, I don't even think it's a DC girl thing, sis. It's just a woman thing. No is a full sentence. Like, it's okay to say, no, I can't do that. It's okay to say, listen, I need a minute. And I, like you, Dr. Presson, I snapped a couple of weeks ago at work too. And then I came back and I said, I'm sorry. I said, I apologize, but I need you all to realize that I am human like you too. I mean, I was walking into work, Christi, I'm dealing with my father, the situation of my family, making sure my husband and my son are okay. My organization, I'm starting these things that I'm doing. And I literally have my bags, just walk in the door like 6:45 in the morning. And it's meet. I'm like, and I have to say, guys, can I please have a moment to go put my bags down? Can you give me a second? And is anybody dying right now? Is this a life or death emergency? And it's important to also prioritize, for me, even if something was planned, if it's not in one of those other buckets, like my family or like life or death, it can wait. It's going to be okay. And I've learned to prioritize my health and well-being too. My husband often gets mad at me because I'm like, I got to go run. I got to go. Well, babe, you don't need to. Like, no, I have to. You don't understand. This is my mental release. I like being outside. I need that fresh air because that's how I find that. So for me, Christi, is prioritizing, being able to say no, and creating boundaries and limits. So I might say, hey, Christi, I can't stay at your party, but I'm going to stop by and say hi and drop off the gift. And then I'm going to keep it moving. And the other thing that I really learned in this last few weeks, and particularly during this pandemic, and I knew this, and I'm sure we all know this as humans, but tomorrow's not really promised. So I'm now choosing, keyword choosing, to live my life in a state of I'm leaving it all in the field and not leaving or living with regrets. And so am I going to regret not doing that thing? Am I really going to regret it? And if the answer is no, then I'm okay to live with that. and making sure that if I can't do it, just say, hey, Takeisha, love you, sis. Listen, my son has this lacrosse game and I really have to go and do that. And if Takeisha really valued me, she would appreciate the fact that I made the call, but I'm prioritizing that thing, not over my relationship or friendship with her, but she understands that I only have a limited number of days and times before my kid is going to be out of my house. So as my sister friend, I would also say that balance, Christi, is who's in your circle.
Mm-hmm.
And if those people aren't adding value, it's okay to it's okay to love them from a distance or to manage that relationship differently. But if you're not adding value and the people and relationships you have, including employment, including your coworkers, that they're always taking and absorbing but not contributing, have those conversations. And I've done that to your point about women in healthcare, particularly as a leader. I've said to some of my nurses, listen, every time it's 7:15, your shift just started at 7. I've heard you complain about 6 or 7 different things. Let me go, let's talk. How are you doing? Are you okay? Is there anything I can do? Because that energy is infecting the rest of the team. And so that's the other thing that I've learned about that work-life balance, that even sometimes in work, you have to help and create a culture of wellness and well-being and creating psychological safety so people therefore are able to do what they've been called to do.
Yes, I mean all of it, and definitely sending condolences, Meedie, on the loss of your father-in-law. We have a lot of people in the chat who are sending condolences, and condolences to you as well, Dr. Judy, who also lost her father-in-law in January. And so, and just highlight a couple more people. Comments there is definitely resonated with everyone, and she said, and I think we need to also be okay with not giving a rationale or justification. If I can't, I just can't, and people should understand that if I could, I would. And it goes back to what you said about who's in your circle and them being okay with your decisions if you can't do something, and them supporting you in the ways that you need to be supported in that time. So I think those are all great points. And we just have to figure out what's best for us, because the way I prioritize or the way my work-life balance look may not be the way yours look, right? And so knowing what is best for each one of us. I think this has been such a great conversation. We are definitely coming and nearing our time. I want to make sure we save some room for comments or questions. So if you have any questions for us, please go ahead and put it in the comments. I'm going to ask each one of you to just share some final thoughts with the audience, especially those that are in healthcare. You know, those women that are in healthcare. What are some of your final thoughts, just to encourage them, uplift them, and just give them a piece that they can just take with them to keep doing the great work that they are doing?
Meedie.
Sure. Great. So here's what I would say. Love what you do, find passion in what you do. And when you stop having, this is a healthcare conversation. So anybody who is providing care to people, whether you're a nurse, physical therapist, dentist, physician, PT, mental health, please make sure that you are always in a place and space of empathy, and ask yourself, what would I do if that was a loved one of mine that I cared for? And I always implore for, particularly for me, for younger nurses that are following and that I'm leading and training and guiding and mentoring, is I say, don't see that person as a diagnosis or a disease process. So often, at least in the acute care setting, you say, oh, that's Miss Smith in room 2 who's getting a bypass. Oh, that's, oh, you mean 22 who has ABC? No, that is Meedie Bardonille, Anthony's mom. That's who's in that room. That is a wife, a mother, a friend, a sister, an aunt. This is somebody who has people who are depending on her. So when you put on what I call the cataract of uncaring, and you don't see that person as who they truly are, and see them as a person and not that diagnosis or disease process, you will therefore be blinded in how you are providing and continuing out to deliver your plan of care. If you lose that and you start having compassion fatigue, as I alluded to earlier, or you start having a burnout, please take vacation. please take care of yourself, because sometimes that is just you needing to unplug and to recharge yourself. And it is okay to do that. And I love that my sister friend, shout out to Valerie, I know who's watching, who mentioned about giving the best of yourself, but you have to take care of yourself in order to do that. So that's what I would say is, take time for yourself. Make sure that you're leading and guiding first with a place of empathy, and then making sure that you don't see, whoever you're providing care for as a diagnosis or disease process. Learn who that person is, and hopefully you will find a glimmer of joy and light. And at the end of the day, ask yourself, how did I make the day better than I ended it? I mean, how did I end the day better than I started?
Okay. So my takeaway would be, I encourage any and everyone to be unapologetically themselves. Be authentic in everything that you do. And when you're being authentic, you put yourself on that pathway to being well, to being healthy, and then you're going to make sure you take care of you. You cannot show up authentically you if you're not taking care of self. And that's what I tell people all the time. Like, just be you, know when to say no. I love the idea of creating a plan. Thanks to my sister friend, Sharice. She has a book that helps people put together like vision boards. I've used her several times for vision boards, but I will set it down every year, or sometimes every 6 months, or when I feel like I need to, if something moves my spirit to add something to it, where I will sit down and say, this is what Takeisha wants. This is what Takeisha needs in order to be happy. Because I always tell people, Dr. Presson is the other person. That's my altar. Takeisha is who I am. And what do I need to make me happy? That can mean, okay, hold up. I just realized I hit that 40 mark. I kind of want companionship, kind of want to be a mother, kind of want to see the world this year. Set whatever goals that you want that will make you happy. That's a part of self-care, making yourself a priority. Unapologetically, make yourself a priority. It is okay. As we said several times, the world will revolve whether you're here or not. So you might as well make the best of it while you're in it. So do that.
I couldn't have said it better myself. I definitely was going to say, don't feel guilty about putting yourself first, because sometimes we do. And it's totally okay. If we are not, our best selves, then we can't give to anyone else. And so it's so important, especially within our field, because we are givers, we are nurturers. And so just making sure that, just like Dr. Presson said, prioritize yourself and your own well-being. This was such a great conversation. Thank you both so much. I want people to know how and where they can follow you. So can you please just let us know your different handles, any links, anything that they can utilize to go and just follow you in your journey?
So for me, again, I am on IG as Nurse Meedie B. Also, if I can, Chrissy, inviting everybody to go ahead and follow us at the Black Nurse Collaborative, all one word, also on IG, also on Facebook, also Black Nurse Collaborative on LinkedIn. And also on LinkedIn, I am Meedie Laverne Bardonille. You will find me there. There's not that many Bardonilles out there in the world, so it's pretty quick and easy to find the freckled-faced nurse. So I implore all of you all to please follow, like, share, however we can provide of any service to you all, let us know. And Christy, I know I owe you something, but we're also having the State of Black Health according to the Black Nurse Summit, which is taking place on May 7th in partnership with Howard University Hospital. So I invite all of you all to please go. Our website is blacknursecollaborative.com. Again, blacknursecollaborative.com. Chrissy, thank you so much for this opportunity to share. And thank you so much to my sister, Dr. Presson, for sharing this space with me today.
Yes, thank you. Dr. Presson, how can they follow you, get to know you, come to your dentist office?
Listen, I don't care if you come to see me, but what I do care about is that you do see a dentist, okay? It's not that serious or that deep for me, but if you end up coming to DimplesDentalSuite.com, we will love up on you, okay? That's just my thing. But here's the thing. I do not hide. I do not run. I am Takeisha Presson, whether it's on LinkedIn, Facebook, Instagram, Twitter. I am who I say I am. It is my platform in order to be authentically me. I always tell people that you get Takeisha, then you also have Dr. Preston, but no matter what, she's going to be real. So
Yes.
that's that.
Yes, I love every bit of it. So, whoever, if you're in the comments, if you are looking at this, if you need either one of them, please reach out to them. As you can see, they are both very authentic and amazing at what they do. Thank you both for being here today. Thank you for having this conversation. I feel like it was a much needed conversation that we need to have. And I'm sure, as we saw in the comments, a lot of people related to, what we were saying today. So look out for us for next month. If you've been following Smile, we have our LinkedIn Lives every month, elevating all things mental health and different topics within our field. And so if you're looking for Smile, you can reach us, our website, smiletherapyservices.com. Come find us on IG, Smile Therapy LLC. Of course, we're on LinkedIn, Facebook, just Smile Therapy Services. And you can follow me as well, Christi Venable. Thank you. Please stay safe. Until next time, we will see you all in about a month. Bye. Be safe.
Thank you for having me. Thanks. I like her. This was awesome.